So, neck injuries in jiu-jitsu. So first of all, you have to know a little bit of anatomy of the spine of the neck. So in the neck, you have 7 vertebrae, and basically first and second are responsible for rotation of your head, which is this movement. The rest of it have very limited motion, but as a whole segment is quite obviously flexible. And each of those vertebrae are slightly different. And what you have in here, you've got structures as the vertebra, which is basically bone, and it has processes, which is transverse processes and spinous processes, though those here, spinous and transverse, which means on the side. And the joints, epiphyseal joints, they are called facet joints. That's not a very good model, but it can obviously give you a general idea about it. And from those little holes in here, you've got nerves coming out. Inside, in the spinal canal, you've got spinal cord, and those are the nerves which go innervate different parts of your body, usually like a shoulder, neck, etc. And you may have, you have also discs, intervertebral discs, a little jelly-like substance, fibrous substance, which holds the water, and it consists of layers after layers of this tissue. And you may have, usually there are some injuries to the discs associated with it as well. I will explain it to you later. And the movement of the neck, what is important, well, later I'm going to explain you about the injuries. You need to know about the movement. So this movement, when the chin goes down, it's called flexion. So you flex the spine here. This movement is extension, and when the ear touches the shoulder, is lateral flexion or side bending or lateral flexion. You may have rotation, and there is also compound movement as well. You can use all the segments in all the planes. Another important structure in the neck is arteries. You've got vertebral arteries, and on the front you've got carotid arteries. I will dedicate all episode to the injuries about those arteries, because this is really important to me as well. So that's the basic anatomy of the neck. Talking about the injuries of the neck, they may be associated with discs, protrusions, extrusions, joints, also ligaments, and muscles and tendons as well. And another one is arteries. You may have a dissection of the artery, and also you may have injuries to the nerves, compressions to the nerves themselves, also to a spinal cord. This is really major injury, which I have a patient currently after the surgery. He sustained injury. No, he's not a fighter, he doesn't do any sports, but spontaneously this happens to him as well. So those things happen. In terms of ligaments and tendons and muscles, obviously you have the same grades of sprains and strains, and you may expect similar healing times, let's say grade 1, grade 2, grade 3 tear, which is really, in terms of the neck, it's really important to stabilize it. If you have ligamentous injury, if it's a grade 3, which is complete tear, you need to stabilize your spine. Obviously, you need to consult your doctor. They probably they may be going to do any procedure for that. Why? Because this is passive stability system of your spine. The ligaments with the joints, they consist of the passive stability system. Active system is the muscles with tendons. They actively going to move your spine in different direction. You may also have disc injuries. So to the disc itself, you may have bulging disc. So if the disc, that structure here, especially with the flexion, that squeezes that part of the jelly, it can come out to one side or to another side, or even to both sides, or inside to the spinal cord. So if the disc moves, disc material inside moves to the side, but doesn't break all the layers of that tissue, it just impinges of the nerve. You call it protrusion. But if the final layer also is torn and the material, disc material, comes out and touches that area here, causing huge inflammation, that's called extrusion. So this can cause huge inflammation. Obviously, the nerves can be damaged or compressed, because all that cushion which is here is like amortizing the shock absorbing for the spine. So this height decreases, which causes also compression on the joints as well. Really painful, and what you can experience by injuring it, it's not only injuring your neck or neck pain. You may have pain down towards your shoulder, fingers, elbow. You may, it consists actually from sensory ends and motor ends of the nerves. So the sensory component of it is what you feel. So you may feel a numbness, tingling, etc. But motor is the thing which moves your muscles. So you may actually develop atrophy of the muscle. The muscle will become smaller, thinner. You may lose the function, for example, flexion or extension. Depends which segment you will have damaged. This is very important. Everything basically is very important, but important is to, if you sustain any injury, immobilize your neck. If you have, for example, fall resulting from judo throw or wrestling throw, any takedowns, and you fall directly on the head, causing hyperextension or hyperflexion, that may be fatal. And obviously, if the person is in huge pain, you better not risk moving it. Call an ambulance and let them do the job. Let them examine the person, whether they can move the toes, fingers, etc. Have a feeling they have the procedure. So be careful with that. So you get different types of injuries. You may have direct impact. Let's say you go for the takedown and you hit someone with the top of your head. That will cause the compressions of the discs and also joints. Really painful. Another condition comes with hyperextension. Extension is this movement. So it's the same. You go for the takedown, for example, but your opponent will block you, and you're gonna hit with your forehead, and it will cause hyperextension. You may have the disc injury with it. More likely, I think, is with flexion, but with extension as well. There's huge stress put on the joints here, those joints. So it's really difficult they will jam, they will cause inflammation. The ligaments can be torn or overstretched. You will develop reactive spasms of your muscles. They will try to protect your neck, so they will tense, and then you may have soreness for weeks or even months. I had my neck sprain when I was a teenager. I did wrestling. I was wrestling with my Greco-Roman wrestling. I was wrestling with my coach, and he jumped from one side to the other, and I reacted and just twisted, and they just went, the muscles, ligaments on one side, on my left side. So they put me in a collar. Unfortunately, back in those days, I didn't have any rehabilitation, so I had to deal with it on my own, and it took me 3 months in a collar. Terrible headaches later on because those muscles went stiff. I had constantly ischemic pain. Ischemic is where your blood doesn't pump properly through the muscles, so it doesn't take that CO2 back on the system, and maybe you have some inflammation, little maybe carbonic acid, maybe not, but you know, it wasn't crash injury whether when you cut your fingers in the door, leave it for 2 hours, and then you've got carbonic acid buildup, and you may open the door and actually those toxins, this carbonic acid, can go into your system. You can die. So it's not the same, but obviously you don't have that proper circulation in your muscles, and that caused me muscle stiffness, headache, pain down to my arm. Actually, it was to my left arm. It was really hot and tingling. So then I had to deal with it on my own. It took me a while. Some failed treatments with private. I went back then. I wouldn't say the guy was chiropractor, but he just did manipulation. That wasn't something what I needed back then. I'm not saying it's bad. Sometimes you need it, but I just needed some soft tissue, some relaxation, some strengthening maybe later on. But I was just a teenager. I didn't know. However, hot baths with some salt, bromine salts it was, helped me a lot. Within 10 days I felt so much better. I could move my neck, I could, you know, do most of the functions which I did before. My headaches gone, my arm pain went away. So actually this guy gave me good advice. Have a hot bath every night with that salt, particular salt. Is from a specific region in Poland, from Iwonic-Zdrój. But I also, nowadays, I use some Epsom salt, some magnesium flakes, etc. But that one, specifically back then, it was quite good. Probably now, when I'm older, it wouldn't heal that fast. But another thing is like a torsion. So, for example, you go for guillotine, you will cause hyperflexion, very likely to injure your discs because you squash those little discs this way, and they can pop out through that foramen here, and you may create some sprains and strains. So that's really important. Another thing with guillotine-like chokes, or it should be called strangulations, you can cause some arterial dysfunction, some tears in the arteries. Very rare condition, but unfortunately it happens. Another thing that you need to remember, that the neck is not only on your back. I mean, this structure is very prone to injuries. So you get trachea, and you can cause obstructions to the trachea. You can break that little tissue here. This is very important. Always, if you're practicing chokes, the coach should be present, or person should supervise 2 people sparring, just in case they're gonna be choked out and the other person doesn't know that the person is passed out already. May hold it for too long, and it may end up really bad. So hyperflexion, hyperextension, you get some rotational injuries to the joints, to the muscles, and other tissues. Strangulation is especially difficult for arterial dissections, carotid arteries and vertebral arteries. Basically, more or less, that's everything. I just wanted to give huge shout out to Chris Martin, whom I will speak tonight with regards to injuries to arteries in jiu-jitsu, and we will discuss his problem and problem of my friend. Basically, it will involve strokes in MMA and in BJJ. Very sad stories we have, and we have some also stories about recoveries from those strokes, but it's important not to miss out on those symptoms. I would strongly recommend to see his vlog, or his name is Chris Martin. I will put the link below the video to his website, so you can check it out, and we will be talking about the arteries. Later on I will try to also make a video specifically about arteries and dissections. Even recently, a few days ago, I had a patient who presented with the same symptoms. It was a neck pain, but I identified that there is something wrong. Very similar symptoms to the arterial dissections, or deficit. It doesn't necessarily have to be dissection, but you have cervical artery deficit and cervical artery dysfunction. Sorry, the dissection. So the guy is also involved in sports, and send him to the GP. GP is general practitioner, medical doctor. They were concerned. They sent him for additional scan. Unfortunately, they sent him for X-ray, which I don't think will show anything. So we will see what the specialist will say, and then if not, then we will try to give him some MRI or something else, maybe even privately. But that really scared me. I thought maybe I'm a little bit over scared, because I had my best friend who suffered from it, and I was reading and learning a lot about this. But it's better to be safe than sorry. So please watch my other videos, and if you like, subscribe. That will help me a lot to spread the news about the injuries, different types of injuries, and later on in rehabilitation and physical or physiotherapy of those injuries. Okay, see you later.